adult programs group here at the library. If you could take a moment before we get started and silence your phones, that would be very much appreciated. Our event tonight is called Local Resources in our aging series about the sandwich generation, meaning people who are sort of stuck between taking care of their children, taking care of their parents, or anyone else in their family or friends. So we're very lucky to have a wonderful panel of speakers today to answer your questions, to talk to you about what's available in our community. So let me introduce you to them, and they'll probably tell you more about themselves. This is Aggie Aspinwall from Lapham Senior Center.
Lapham Community Center.
Community Center, sorry.
That's okay.
Bethany Zaro from Human Services, which is part of the town of Canaan. And Bethany, oh, no, I'm sorry.
And Gina from Staying Put.
Yes, sorry. And Robin Bates-Beeson from Staying Put, who have partnered with us to bring several different programs like this. And we have another one coming up on March 28th, so keep your eye on the calendar for that. So I'll turn it over to Robin, who's going to get us started and ask some questions.
Great, thanks. Thank you so much. Thank you everyone for coming out tonight. This is part of the Sandwich Generation series seminars put together with Oasis Senior Advisors. And if anyone has a question, Paul and Susan are in the back and they're here tonight with us as well. But this program is called Local Lifelines. It's local resources. And so who we have here today, as Heather said, is we have Aggie from Lapham to just go over some of the programs that are available at Lapham that some people may not realize about, as well as Bethany Zaro from Human Services in town, what resources we have available. And then of course, Gina Blum is the Executive Director of Staying Put, and she'll be able to tell us everything about what Staying Put, what membership means, and what services it provides. So Aggie, since you're on the end, if we could start with you, if you could give us an overview of Lapham and the services.
Right. The Lapham is the community center for the town / senior center, because our hours of operation, which are changing, are 8:30 to 4:30. So we get mostly retired people from 50 to 90, and we do all sorts of educational programs. We do history, we do art, we do languages, we do cooking classes, we do whatever anybody wants to do if we can figure it out. We do a lot of bridge games. So we see people who now have transitioned out of work and are home, and they come to Lapham and they start a whole new phase of their life. There's a whole new phase of education and entertainment and meeting new friends and making new friends, and that's what Lapham is really about, and that's what we do every day. And Lapham offers a lot of services. We do over 500 Medicare open enrollment Part D appointments during the open enrollment period. This year we saved the residents over $1 million. It was wild this year because there were a lot of changes. And some people plans really went south on them. So it was very important, and it's very important to do that every day. We have Bethany comes and does blood pressure clinics for us. We have hearing screening clinics. We have an Ask the Attorney appointment. We have lots of services that are that we offer, and we are also the first line of defense for something. They come to us and say, where is this? How do I find this? Where can we do it? And if we don't know, then we send them off to Bethany to do it. And so the Human Services is the problem solvers, and they get to handle, you know, when there's an issue that we don't know automatically what department to call or who to find out. We send them to Bethany, and then Bethany takes them from there. Go ahead, Bethany.
I'm Bethany Zaro, the Director of Human Services for the town of Canaan. And Human Services, people say, well, what do you do? And we do just about anything when someone comes in. Normally, Human Services, people think, well, no, I don't need to apply for food stamps. I'm okay budget-wise. It's not just about budgeting and being short on resources. Although we do help with that in terms of food pantry and getting you on state and federal programs. But being in New Canaan, the mission statement is to assist individuals as well as provide education and information and resources where needed. And we are a wonderful community filled with vital people like yourselves. You're out here tonight. And so we our department is very special in terms of we have a lot of clients that need assistance financially. We also have many that just utilize us, and they even come in and say hi to us. They bring their dogs. That's what we want. We want that rapport, because as we shift into different stages in life, it's always nice to walk in, open the door, and go, oh my gosh, I'm having a hip replacement in 3 weeks, or my husband is, and Medicare is not going to pay for all these things that I'm only going to use for a couple of weeks. Well, we have a loan closet. You know, we have even the N.I.D.E scooter and the crutches and the walkers and the transport chairs. So just to come in like that starts a rapport. And then as we age, as we all want to age in place, other issues come up in terms of more companion care, agency care, or someone will say, you know, taxes, the taxes, where are they being done this year? I have to say, we take any and all questions, and if we don't know the answer, we do find it. And if we see that there's something very happening a lot, we can start programs, things like that. We do the renter's rebate, which is done through the state, but Marcy Rand, who's our adult senior caseworker, so anybody out of high school goes to her. She has renter's rebate. If anybody rents, you can get a rebate if you qualify for 2023, and that's happening now. You can definitely come in, and the appointments start in May, I believe, April, May.
You can do it.
No, April, yeah, and she's sending letters out to those that always apply every year, but if you're interested, call Human Services. We want to be the go-to and the high-to. Some people, they just are feeling a little isolated after a storm. You know, they've been in the house all day, so they come in and they say hi to us, and then it's always interesting how some questions come up. And we're always able to answer if they're really finding that they need help or they're feeling lonely, things like that. We talk to them a little bit, feel them out, see what's going on. And maybe Aggie has some classes. They've just never done the Lapham Center before. It's just showing them the things that are in the area.
We're so lucky in New Canaan that we are small enough that we can look at the individual and we can do a case-by-case thing. We can find out what that specific person needs and how we can help them. And Human Services is great for that.
We really want to be there for and embrace the community for what your needs, my needs. I'm here too, and I'm moving up the age bracket. And I think about, you know, aging in place and wanting to stay here, and you just want to have this purpose in life still. And I think that comes with making friends, feeling comfortable that the friends you have, you can keep in touch with, not just the ones that live here, but the ones outside. And we really want to be a place to where you can go for a resource, like a resource that you definitely need, or just to say hi. And sometimes you find out a resource that you feel comfortable talking about. So we're here, and we just love having people come in. So that's our job. I am a choices counselor, so we tend to the Medicare Part D enrollment. Aggie and Kathy set that up and work on that, but if there are issues, we really need to call Medicare or get on the line and call, time-consuming thing, then we come to us and we can help sort out that issue. It's overwhelming, like where do I start, who do I call? And then,
could you just say what, for those recorded people watching, what choices, what that program is?
so it's the Connecticut Health Insurance program. Let me go back a little bit. There are 5 agencies on aging in the state of Connecticut. Every state has the agency on aging. We're divided up into 5 areas, and ours is the Southwestern Connecticut Agency on Aging. It's called SWACA. And every year there's a representative that represents that for New Canaan. This year, Kathy, she is I was it last year, I think. But it's a 2-year commitment, and you just keep SWACA the Agency on Aging up to date in your town. And so they have choices counselors, and they train people and keep them up to date on their training about the health care choices and issues. If you have issues and advocacy and just discussing long-term care, aging in place, elder care, legal care, things like that. They are a wonderful resource because they are current in who should you go to.
Right, they know who to contact in the state. If you're running into roadblock, they can get you through. Because they're connected to the state agencies, and they know who to talk to and how to get you the information you need to help you if you have a big problem with any kind of insurance.
Yeah.
Yeah.
And so it is advocacy for all insurance as well as Medicare, Medicaid, which is huge. And they definitely, we work with them all the time. And what's great about Choices is there's an 800 number, and they'll get back to you. But you can also call Human Services, because we can get you a direct number. We know who you need to talk to, and things like that. It just makes the town a wonderful place to live, and we want everyone to feel that way, and just age with comfort. That's why we're here.
So I'll pick up from there. I am Gina Blum. I am with Staying Put in New Canaan. And the wonderful thing about this town, there are so many wonderful things about this town, and the resources that these ladies were speaking about are available to everybody in town. Staying Put is a membership organization, and it is a nonprofit organization, so somewhat different, but we all work together because we provide really important services to seniors and their loved ones. So what we do is we help people age in place, and that is a national movement. So if you have loved ones or you're thinking about somebody who doesn't live here in New Canaan, there are other organizations similar to Staying Put that help people to remain living confidently in their home and safely. And so they are providing important services like we do, which are transportation. So we have about 100 volunteers who do rides and give people assistance in that way. They do grocery shopping, they help with small tasks around the house, they might help with errands if need be, and they do all sorts of things, visits, phone calls, and whatnot. We have a staff that helps people with the issues, and all of us serve as resources, with questions for people, being able to solve those issues and answer questions. We also provide social activities and groups, because isolation is one of the biggest issues and harmful things that affects people as they age. If you isolate at home and don't get involved, it's really detrimental to your health and your well-being. So we try to, we collaborate with the library, also with Lapham Center, just to make sure that we have a robust schedule of activities for people, and at different, to suit different interests and abilities and passions that people have. So we do things to bring people together, to help them remain living at home. We can refer to people. For example, if you are concerned about, you need something fixed around the house, we might have a volunteer who can help with that. We might have, whether it's even technology. You need some help with your iPhone, your iPad, your computer, your remote control on your TV. Whatever the need is, we can send a volunteer over to help. But we also have a vetted list of people that we can refer to when you need help in the house, and that might be, you need a licensed plumber to fix that thing, or an electrician who's licensed. And you don't want to just pick up the phone book, even if I don't even know if there are phone books anymore, but you want peace of mind that the person that you're calling on can be trusted. And so we've done that vetting to make sure that you're not going to be taken advantage of, because unfortunately that can happen. And sometimes there's fraudulent people who take advantage of a situation. So we're making sure that you can call upon somebody to help you get a fair price and get the work done in a good way. And then we do activities, so we're getting people out to educational events, to art locations, to whatever might be interested, or even out to lunch. So we're trying to make people active and stay engaged in the community. we provide all sorts of services to help people age in their homes, and that tends to be the trend. People are interested in aging where they have their roots, you know, where they've raised a family, or where they have friends, or where they're churches, or whatever they are engaged in. So we want to make sure they're able to do that with confidence.
Thank you. So this is the sandwich generation, and I know a lot of people will be watching this later on. And so here's my question, Aggie, you first. If I have a parent who lives here in Canaan, but I live either in another town, another state away, and I'm worried about them being isolated, how can I work with Lapham? Or could I be on, as the adult child, on the Lapham newsletter? Can I get that information out? And then how can I get my parent to Lapham?
Right.
What are the ways?
Well, definitely we send emails out to the adult children of parents that are in town, especially once cognitive issues come into play. So they can help them and remind them, oh, remember you love that cheer fitness class, you want to do that one, you want to do this one this semester, and they'll even pay for them. And then they'll even schedule the get out to pick them up and bring them to Lapham. And then when they get in a routine, that really works until they have to have home care. And some of them have home care, and the home care person does it. And we will email them to keep them in the loop of what's going on, and when the movies are coming out, when we have book groups, when we have, whatever it is that they're interested in. If they want, we can keep them in the loop of the information, which is important to do. I mean, it's hard to relinquish that sometimes for some people, to see their kids scheduling their life. They're telling you what to do, and it's like they're trying to help. Sometimes they are telling you what to do, but sometimes they're trying to help them and trying to get them to go out and give them the little push that they need to get out there and do some more things. But it's important to keep going, to keep working, keep learning, because it's so bad for your health just to start closing in on yourself and not do stuff, not get connected.
So how does that person get on the newsletter?
All they have to do, they can sign up for the newsletter anywhere, anybody, any place on the town website.
So newcanaan.info?
Yeah, Canaan.info, it's sign up for the e-newsletters, and they can sign up for it, doesn't matter, we'll send it to everybody anywhere, doesn't matter. Or they can just give us a call, and we can put them on the list.
Right, and your phone number is?
The phone number is 203-594-3620, and they can call that, and everything is on the website as well, and it's got all the information on there, on the website with the phone numbers and our names and everything, so if they want to contact us. We have a lot of adult children that are watching their parents and helping their parents, because even during COVID, I had one daughter who was living in Hawaii turn the Zoom on for her mom in New Canaan remotely so she could watch some of the stuff that we were doing. So, we want to keep them engaged as much as possible.
Right. And you mentioned, and I don't know if Bethany wants to bring this up, you just mentioned Get About. I don't know if people watching the video or everyone here knows what Get About is.
Get About is a service in town. It's a $3 a ride donation for non-medical and free for medical services. And it is sponsored, the town sponsors some of it, but they are volunteers and paid drivers that drive residents all around town in the little Get About vans. And all it is a 24-hour notice phone call to the Get About, which is 203-972-7433. Call them a lot. You schedule it with Judy, and she will schedule an appointment and bring you and pick you up during their hours of operation.
To add to the Get About, what I am seeing with more people aging in place, they're still driving, everybody's still driving, but they just don't feel comfortable going outside of New Canaan, into Stamford or Norwalk, onto the Merritt for a doctor's appointment. So they're using the Get About just when they go out of town, and that's fine. You don't have to literally not be driving anymore to use the Get About. If you're just, going to a doctor's appointment, like, oh my gosh, it gets confusing. Your parent,
They only go so far. They go Stamford, Norwalk?
Stamford, Norwalk, Wilton,
Okay.
and Darien.
And Darien, okay.
Those 4 towns, so
For medical appointments.
for medical appointments. but only in town for errands. But if you feel, or if someone just feels like they're fine in New Canaan, but the driving outside into more traffic areas, call the Get About.
Yeah.
Yeah, start there. So that's a good.
Could I ask a related question to that? You're saying that you need to give them a day's notice, but what happens if you're not feeling well that day and you don't have anybody to drive you and you don't belong to Staying Put? So can you still call Get About and see if they're available?
Well, you could try. You could try to see it if they have a driver available. It's usually a 24-hour notice to get on their schedule.
So people make them, yeah, you're right. So if it's something quick and, then what we're trying to also is having people understand the Uber and the Lyft and the taxi.
Right.
I mean, you should get, definitely, because the Get About, it's not a quick pickup.
No, and doctor's offices sometimes, especially if it's something that you're sick on, if it's an emergency, you call 911 and go with the ambulance. Don't wait around, don't try and get a ride, don't figure it out if it's an emergency. But if it's just for a doctor's appointment and you need to go to the doctor, usually it's not an immediate emergency, you have to go that day. If you have to go that day, then you have to call an Uber or the taxi. In New Canaan, that's all we've got, we don't have anything else. I mean,
Well,
it's
Gina,
Staying Put.
if you want to talk about it.
Yeah, so sometimes, I mean, it's difficult to schedule immediately, but it happens. Today, someone had called us, so Staying Put, we do respond a little quicker if people need that. It just happens, and we know, someone was sick this morning, they got into not terribly sick, but she wanted to see a doctor, and she called and she said, can you bring me this afternoon? I'm not feeling comfortable driving, I'm just not feeling right. And so, yeah, we do that. We'll jump, we're not gonna be able to find a volunteer, but I'll get in the car and we'll bring somebody and we make sure that.
I have a, would you speak a little louder when you're speaking? Both of you, your voice is kind of.
I have a question about Get About too. How about people with wheelchair? Does
They have wheelchair access.
All accessible.
Yeah,
All the
vans
vans are wheelchair accessible. Because of insurance and the liability, they cannot come into your house and help you get out of your house. And they will meet you at
In the driveway.
in the driveway, the front door, and they'll help you open the van door, they'll open the van door for you to get in. But if you cannot get from your house to the car, if you have an aid, then that's fine. But if you can't do it yourself, it's just the liability, that's what they do. So it's very basic helping getting in the car.
And Staying Put can be a little more flexible because we do use volunteers, so we can go into a home and help somebody if they need assistance. We can also accompany somebody to an appointment, so often, we have someone who just asked the other day, can you come with me to my doctor's appointment? And yes, we will do that. They wanted a second set of eyes, somebody to take notes, and that's so helpful sometimes because you get so much information at an appointment that you might forget something important, so we'll do that too.
I also want to, I'm sorry.
I just have a comment about the wheelchairs, which I discovered because I borrowed wheelchairs from you, which was fine, that worked. And then I decided I'm going to get one. So I purchased a used transport wheelchair. And they don't want you to have a transport wheelchair in the Get About. Did you know that?
Yes,
You knew that.
yes, and I know that because it's not safe to travel in.
They said it's, right, they said it's not safe because it's too light.
Interesting. I didn't know
You
that.
didn't know that? Oh,
Yeah.
you're welcome.
That's good. That's good.
I didn't know that either. Yeah, I thought it was smart.
And that's, see,
I
that's
would-
what
I
we
would
like
be able to
sharing.
bring back your
Yeah.
wheelchair.
No, it's good to share these things.
Does Get About have a limit on how many rides you know by
No.
chance? No.
I don't think, well, I mean, I don't think so.
I just statistically, I know last year they did about 8,000 rides. This year, for 2022, for 2023, they did almost 10,000. So we're back up to pre-COVID and beyond. So it's a very vital service in the town, but definitely not as flexible.
you also want to make sure the timing of your appointment
Right,
is within their
Hours.
right,
Yeah, that too.
right.
I wanted to mention something that Aggie said, when adult children call about their parents, we will get calls at Human Services saying, I'm really worried about my parent, my mom. My dad says he can take care of her, but I'm worried about him. Can you call him and see everything's okay? We would never do that in terms of privacy. What we would say is, have your mom or dad call us, and, for you to have that conversation, but we would never disrespect someone and take, without knowing that person and having them call us and form a rapport. We just wouldn't.
Out of the blue, it's
Out of the
really
blue,
hard.
it's really hard. Yeah.
Cold calling doesn't usually help, and they don't usually answer anyways. But if I call them and I know them, and I say, hey, it's Aggie, just calling, checking on you, haven't seen you in a while, that makes it so much less invasive, and we're just checking on them, and they love that. So, and sometimes they'll call us back, and sometimes they won't, and then, we have to go forward from there. But it's really hard if somebody calls out of the blue and we don't have any kind of relationship. That's why it's so important to have a relationship with everybody.
It's scary, yeah, they have someone call and say, hi, it's Bethany.
And if they don't know you,
They don't know us.
they've been trained not to believe anybody anyway,
Exactly.
so, like, who knows if that is, so
Yeah,
unless
so
they
the
know who we
suggestion-
are.
And that's why we love getting to know people before they need us. And just saying hello, and it creates definitely a communication and just an opening to be able to assist in any way. The other thing is, we have a lot of adult children saying, can you just get my mom out, or, I know she's home alone a lot, and it's a difficult thing in terms of someone's privacy. And I know, at later stages in life, some people think, or older adults, like, I don't want to change. I'm used to the way I'm doing things, and it's hard to meet new people, and I don't want to make that effort. That's why, as we age in place, keep going out, even if it's just to the grocery store, to get your meal. It really does help, and it stops your mind from thinking, I don't feel like it. Because that's our first response.
Yeah, and the thing is, you can't make them do something they don't want to do.
Right.
You want to try and get them to get to things that they want to do. Try and find the things that they're interested in, that they want to do, and that gets them out. It's much more motivating for them if it's their choice, their decision, their thing. You can't just, you can't make them come. You can't. They're adults. They make their decisions. But we try and entice them with lots of fun things, and free events and movies and whatever it is, just to try and get their spark. Once they get in, then we've got them.
And we too try to keep track of people and invite them to things, and that personal attention that we give them, and call them and say, we have this going on, you might enjoy this. And if they say no, then we'll call them about the next thing. And just keep asking until we find something that connects, and they know someone is waiting to meet them when they come in the door, and it's friendly, because it's difficult to try something new. So
Right. And it's very good for them to have a friend ask them to go. You say, what, have you seen her lately? No, why don't you give her a call and see if she's ready to come over for coffee, or invite her over for a luncheon or something. And they do so much better if they come in pairs. Yeah.
So here's a question.
Yeah.
Bethany,
It's back to the transport. As a member for Staying Put, what is the transport perimeter? Is it just New Canaan?
No, thank you. It is within New Canaan, but also Stanford, Norwalk, Darien, and a little bit of Rome.
And actually, a couple places in Westport.
Oh.
Okay.
I'm sorry.
There's a couple of places in Westport, some,
Okay.
Eye doctors.
doctors that our members go to, so our volunteers will go there as well. Question for you, so if I am living in California, my parents are out here, or my mom or my dad, and I know Bethany worked with the health department, and my parents say, well, I need a flu shot, but I don't know where to go. And if I were to call you, where would they be directed?
So right now, because of grants with Canaan, we have a public health nurse that will do house calls for flu, homebound, right, they just won't go out and sit down.
Just because if you're driving and you're still getting out, you can go and get
You
a
can
flu
get
shot.
a flu shot.
We do a flu clinic at Lapham, their flu clinics, I don't know if the health department did another one, but you can go to the pharmacy and get it. You can get a flu shot anywhere now, but they can call us and ask where they can get it.
Yeah, and home care
And if they're
agencies.
homebound, then for sure.
For sure, so I would have them I would transfer them over to the health department and to set something up and to see, it's about just difficulty getting out of the house.
Right.
Would definitely qualify, and yeah.
And also if they're home recovering from something and they need food, Meals on Wheels, if they're homebound, even if it's for a short time with a hip replacement or a knee replacement, or doesn't matter what age you are, but you can't get out and you can't drive, Meals on Wheels, there's a certain requirement that it's available to them. So if they're worried about their parents not getting enough food because they're not driving because they had surgery or something, then that's another resource in New Canaan.
Can you talk to Meals on Wheels at all for us? To the parameters?
Yeah.
Yeah.
Gerda?
I was on, since you're talking about flu shots, what about, when we had COVID, we also got the boosters through the health department. Now, if you get boosters, is that through your physician?
Yes.
Okay.
Pharmacies, right?
Pharmacies, so the health department, the Department of Public Health in Connecticut no longer offers vaccine for COVID. They will for children 18 and under. I don't even know if they still do that.
I don't even know if they still,
Does anyone know whether it's less pricey through the pharmacy versus your doctor?
I don't know.
Probably the
It's-
same. Probably the
Yeah, it's
same.
probably the same because it's Medicare, and so Medicare will pay, anyone over 65 will have to pay whatever accept the Medicare payment.
Mhm.
So,
Are we to keep our cards
I know, I do. I keep it, I don't know why.
still in our wallets?
I do.
I have mine too.
I have mine, I'm afraid.
Oh, I have.
Yeah. The other thing I wanted to mention is Human Services has a vulnerable population registry. And this is what a lot of the adult children, they get their parent or parents on it. And in the event of a natural or man-made disaster, Human Services has a list, and it's a registry. So you put down your name, your address, whether you have some medical equipment that you need, such as oxygen, and then you sign a release, and you give your emergency contacts. So let's say in the event, like Hurricane Sandy, we did that. We got out the vulnerable population registry, and we called. We also worked with churches, staying put. We did not want to duplicate the calls. Some person who was very active in the town would get like 4 or 5 calls from all of us, but then there would be one person that didn't get called at all because they just didn't get out in the community, or they were new, things like that. So we started this vulnerable population registry, and let's say, look, all the electricity goes out. We would try calling the house. If the house, no one answered, then we would call the emergency. Or we have emergency contact neighbor, things like that. If nobody answered, or if someone did answer an emergency contact and they thought, I don't know, I can't get a hold of them, then we would have a first responder go out. So that would be police, fire, EMS.
Search did some of it.
To check on the person, on the household. And some people they'll say, they want us to know where the key is, things like that. And this, nobody sees this folder, so we don't take it out until it's time to take it out. We would never call you and say, oh, a big storm's coming, are you ready? We would not bother you that way, but just in the event that there is an emergency, just know that we would contact you, but it has to be a registry. And so every year we update it. and we call back, we just make sure someone has the right emergency information.
What about if they are not home at the time? What about if
Well,
they're traveling? They're not, so you don't get answer from them.
Right, so then
And
the
then you
first
send-
responder would go
Well,
to
they
the
check the
house.
house, they check the
They
house.
check the
So you
house.
go to the house and then,
And then, so let me tell you, so this is why it's a registry. I've had a couple situations where someone, signed and said, oh, yes, and then this happened. Their electricity went out, when it went out for 8 or 9 days. Could not get a hold of this woman, this person, and neighbors were calling, haven't seen anything, the emergency. So we went, the first responders went, and the firemen or the police opened a window, broke the latch. The woman was out of town, and she was livid. But we said, and they fixed it, they repaired it for, for free. They wouldn't expect you to pay for how they had to enter, but there was no one there. But she never told anyone she was leaving, and she had signed this registry. So he said, you signed the registry in the event. She goes, she said, I want that back, and she took it. But then there was another woman, same storm, that was in medical distress. And we did go to the house, and she was unable to get out of her bed and transported to the, and they broke her window, and she didn't want them to pay for it. I mean, but just comedy to it. But you're gonna just know that, yes, they would try to enter.
so if you sign the registry, you are responsible to let them know when you are going
Well,
away.
you could just call in from wherever you are. I mean, people are, it's a cell phone call away. You can to let people know that you're calling. And hopefully, right now, the way the messages go, you get a message on your cell phone from your, even if it's forwarded from your home phone, you could call them and say, hey, I'm fine, I'm just on vacation, don't worry. Or I went to my daughter's house, that's where I am. Great, we were worried about you, we were checking on you. We'd leave a message, we wouldn't send the fire and the police and the ambulance to go first thing. We call, we wait to hear.
We really do
We
try.
call again, we wait to hear. If nobody's around, we're worried that the situation is somebody's in their house and they've fallen and they can't get up. A broken window or a broken latch is no big deal if you're stuck on the floor for 2 days. So those registries are important, and especially at a certain point. Not everybody needs it, not everybody's ready for that point, not everybody's
It's
there,
really,
but
if you have
you're alone
multiple
and you
issues.
have multiple health issues. It's important to have that, and that's just a safety, it's just a safety net.
And the kids can't sign up their parents for it. The person has to sign.
The person has to
The
sign.
person has to sign because, if someone had to enter, you have to have permission, and that's why it's a registry.
Right.
Just out of curiosity, if the person is found incapacitated at home and the adult child cannot sign them up, but now someone has to respond for this individual, do you keep power of attorneys, health proxies, anything? So
That's why it's a registry.
Yeah, we'd have to contact the family.
Okay, so, but first aid will come for that individual who's fallen, incapacitated, and then I guess the mechanism starts at
Right.
that point.
Yeah.
So-
Right, and it's in the event of a disaster. So this is when, we just checking. So please feel free to call Human Services, and it's a one-pager, it's nothing. We don't find any personal information about you except contact numbers, and so someone that had oxygen, we would obviously make sure we got a hold of someone first, things like that.
And where are you located?
So we are behind Town Hall. It's called the Annex. It's the old Outback Teen Center. It's got the funny roof. We are in the lower level, so you park right in Town Hall parking, and the door, there's a sign that says New Canaan Human Services, the Annex. And we're there 7:30 to 3:30, except Fridays, 7:30 to 1:30.
It used to be teen center.
Yeah, it was the old teen center.
You all are the experts on senior care, and you have seen so many. I just can't imagine the wealth of experience you have. If you had a medical emergency and you had a choice to be able to be transported to Norwalk Hospital or Stanford Hospital, what you've seen with seniors, with the billing or with care or whatever, and you had a choice, where would you have them send you?
Well, I usually ask where are your doctors? Where are your doctors? If your doctors are affiliated with Stanford Hospital and you have a choice, so most of the time you don't have a choice, they take you where they're gonna take you because it's the closest one, or it depends what the emergency is. But if you have a choice, I'd say where are your doctors? If your doctors are all affiliated with New Gons, and go to Norwalk. If all your doctors are affiliated with Stanford Hospital or Stanford Health, go to Stanford because you'll see your doctor much faster.
And unless there's cardiac issues,
Right.
they have to go to the
Closest.
closest hospital, and
Yeah.
that's Norwalk Hospital. But they're with St. Vincent's. But New Gons has been bought out by Northwell, so that's gonna be a huge conglomerate. So there should be an uptick in, just the level of what they're gonna be using Norwalk Hospital for. It's gonna be huge.
You've seen a difference in the insurance claims and the difficulty, maybe one versus the other and how seniors are viewed or treated or Medicare's.
No, my biggest advocacy for me is if I had a parent going into a hospital, I don't care what hospital it was, there's a tendency for the discharge planner to get them out. And what a lot of people call us for, my mom, or, my husband's being sent, he's being discharged, and he's not ready to come home. And I don't even know how to take care of him. So this is when we start with, okay, have you spoken to your discharge planner? Or else they'll say, they said I have to go to this one facility. I live so far away. What choice, did they give you any choices? No, they had told me I had to go there. Yeah, they're supposed to give you 3, and a lot of people call us to say, okay, what's the best one right now? And we get feedback. What's the best one, the cleanest one? They want to know the best one for different reasons. So we hear, we love feedback. People call us and say, oh my gosh. We don't give negative feedback, but we give the positive feedback. We would never tell somebody not to go somewhere, but we would say where we've heard that's very, very positive, what do you call them? The reviews, very positive reviews. So we don't know a lot that goes on with the insurance, but that's when you call Medicare, or you call Human Services, we can get you a hold of a Medicare advocacy group, Choices, SWACA.
SWACA would be.
SWACA would be
If
the
it's
one.
an insurance issue that's not being met, and we can't get an easy answer, then we would go on to SWACA and get their Medicare advocacy person involved, and they would start working on it. Haven't heard any big horror stories. They'll come in and tell me if it's a horror story. I'll get the blow by blow.
Yeah.
But I haven't heard anything compared to the 2 hospitals. Medicare is actually really good insurance. So they do take care of them if they.
It's just that
Huh?
Original.
Original Medicare, not
Yes.
Advantage plans. Not yet, anyways, or not. Those are insurance companies, and they rule what even the doctors can do. So,
But I would say it's being in touch with your discharge planner and making them accountable for the information that they are giving you, that it's accurate, if there's any more information, you want to make sure, has this been approved by Medicare? I go on and on about that. That's my big thing, is about people being discharged too soon when they didn't have to be.
Why do they do that?
The insurance companies are usually behind it. They'll be in touch with the hospital and say, okay, this person came in on this date, this is how much time we're giving them. That's it.
So the hospital gets money, so if they say, okay, the maximum is 7 days, they get paid for 7 days, but if they get you out in 5 days, that's 2 days profit they got.
But if they get you out later than that, we get paid.
Then they have to pay. Yeah, so it's a game, and it's a money game.
And they
How
give you
would
half
you
a
know
day's
that?
notice, maybe.
Pardon me?
And they give you half a day's notice, maybe.
Half a day, yeah, exactly.
You don't even have a chance.
everything moves so slow until it moves really fast.
And then you're out, yeah.
Yeah.
So how would you know that you're being discharged 2 days early? You wouldn't know.
Good luck.
Yeah. as soon as someone that I would know that entered the hospital, I'd say, I want to talk to the discharge planner. They've got a file. They immediately, it goes to discharge planning, and they get set up.
And isn't the rule still in place about admitting and being being
Observation period
Yeah.
versus admitting.
Mhm.
You want to be admitted.
Mhm.
I mean, I don't, you can't force them to admit you, but they should, yeah, you may have to make it clear that you understand that you're in observation right now in the emergency room, and when am I going to be admitted, or when is my wife going to be admitted? You push things along too, but it's just empowering yourself.
What's the difference between being observed or admitted?
Observation insurance won't necessarily pay.
Right.
Admitted means there's an event that has happened, and now it's hospital. And that puts in Medicare,
Everything kicks in.
everything, Medicare A, Medicare B, things like that. But observation,
Well, under observation, if they're doing certain tests on you to rule things out, your insurance will pay
Yeah.
for it, but it's more expensive than if you're admitted.
Right.
yep,
It's under a different kind of insurance, so you'll end up, you know, if you have out of pocket, if you have to cover, you'll end up paying more. When it's observation.
and just ask, you don't have to know all this. Ask someone at the hospital, I need to know what's going on here in terms of what insurance is being covered. You don't have to know anything, you just have to have the courage to ask and to talk to the discharge planner.
Is someone there 24 hours, or let's say you end up being there after
No.
dark?
No, but the process, let them know, when you get one, you want to start talking to them. And,
Keep on, if they don't keep producing one.
yeah, you make them accountable.
So I'm an adult child, I'm living in another state. I know now that I can get my newsletter for Lapham to know what's going on, I can get find when the hearing screening is for my parents, tell them to go. I can be in contact with you, and though I can't say, hey, go check, but I can try to get them to contact you to register,
For the vulnerable
registry,
registry.
anything like that. But if I see this and I think, yeah, I want something a little more for my mom or my dad, what is membership? Can I pay for membership? And if I don't have money in are there scholarships available? How does that work?
Yeah, so with Staying Put, there is an annual membership fee. It is $400 for an individual and $500 for a couple. But there is a scholarship fund that we have, so if you are not able to make that payment, we will cover you. We want everybody to be able to afford it. Often we have adult children who will pay for their parents. Some have made them holiday gifts, you know, and whatnot, but it is a peace of mind for that adult child to know that we are on the case and helping and giving the assistance, the advice. You don't pay for rides, you don't pay to attend events, you don't pay for classes or anything. If we have something special like people who are going out to a restaurant for dinner, you would pick up your own tab for dinner, but otherwise, you're basically, everything is covered for the year, and the resources, the advice, the help, the whatnot, and we work with those adult children too. So we do the same thing, like you said, you have the form where with emergency contacts. We're hoping that we get that information from our members too, so that we know who to be in contact with, who to let know what's going on, or who we can speak with. Because we also appreciate the privacy that individual has, so we don't go to that child, the adult child, unless, concerned about something.
I have a question. It's not a personal question, but it has come up in my mind, like, suppose someone's alone in town, they don't really have, maybe they don't even have adult children. There's nobody on call, kind of. Are there, like, advocates? Is there like an agency or something? You know, we're.
Well, if they're incapacitated, if they're, don't have the capacity to take care of themselves anymore, there are legal services you can put in place for that person. If they shouldn't be paying their bills anymore and they have no other family or something, there could be a power of attorney put in place But it could be, it's gotta go through the legal system.
Or if it's just someone who might otherwise be competent, but they can't kind of manage the logistics of being in the hospital and getting out of the hospital, you know, all the things you were just talking about. Are there people who just can kind of be, you know, you hear that expression, what's somebody can kind of watch, help negotiate those things to get out. you know.
That's really when you're in,
So it's that.
this
Quite
is
you
where,
are.
pardon me?
It's not quite what you're talking about, I mean.
Yeah, so my thing would be that this is where, as a person aging in place,
Yeah.
there should be some type of contact that you have, right? Called human services. And we have people that we have been checking on for years. And not that we would take any personal information from them, nothing. But they know to call us if they need something, and then we can get something in place. Yeah, it's a real, there is a responsibility of the person though,
Right.
that does need to be accountable for themselves in case something does happen. We try to empower people so that they don't get into situations. There's also adult protective services, which sometimes, if someone is a danger to themselves or others, physically, financially, mentally, there's exploitation going on, abuse, things like that. We do get quite a few calls about situations. We can't call Adult Protective Services because we heard about someone, but we're mandated. If we saw something or talking to someone who was personally experiencing this, there are mandated workers in Connecticut, anywhere, that would have to call. But there are also some good citizens, good Samaritans that say, I'm so worried about my neighbor. I'm so worried about my
That
neighbor.
happens a lot.
Yeah, it happens a
There's a
lot.
lot of people looking out for a lot of people.
Yeah, and
Which is doesn't happen everywhere.
exactly, it doesn't. Or there's been EMS, or with EMS, if someone has called, we've done 6 visits this month because they needed assistance getting out of bed. And as we say, so it sounds like they might need some more help at home. But if they're not willing to get that help, you can call Adult Protective Services anonymously. And then what happens is a case, a social worker will get the case, and they will call Human Services, and we will go out with them. And now that is a call, that's a knock on the door.
Yeah.
That's a knock on the door, and it's to help the person. It's nothing that they've done wrong. It's checking to see if they are able to make self-determination, a decision that keeps them safe from harm.
This person that couldn't get out of the bed, did she live by herself? Was she alone, or was she living with someone?
In the emergency.
She was living by herself.
Robin, can I, before we wrap up, Paul and Susan Doyle of Oasis Senior Advisors would like to talk about next week, the next program.
Sure.
So whenever you're ready to wrap up.
We have one question.
Yeah,
Which is
okay.
one question.
I'm sorry, really quickly, just to have a fuller understanding, so if there's an individual who, you get a phone call from a neighbor who's very concerned, and the neighbor's constantly talking to this person, suddenly realizes or thinks there's a cognitive decline, it's middle of winter, she's like and they call you, it can be an anonymous call, and you will call the adult child, or you just take over?
No, so if they called, we would tell them, if they feel comfortable, and we strongly encourage them to call Adult Protective Services. Because then Adult Protective Services calls Human Services, and then it just gives us a segue into making sure, seeing that they're okay. And we've had to, get to levels of getting a conservator, things like that, because, the person did not, this is to help them. It's to help them, it's nothing like, oh no, you shouldn't have done that. No, it's about, they could be out in the snow without a jacket on in the dead of winter, and that's a danger to themselves.
So that's what I mean, there's a cognitive decline.
Yeah.
And it's not very obvious in some cases. They can hold a conversation,
Yeah.
but you don't realize, like you say, they're outside showing
Then you
us
see it
their
like
jobs.
Yeah.
Right, okay.
Yeah, so Adult Protective Services, you can call Human Services first, we can give you the number, you can SWACA, you know. But there are 2 or 3 case managers that service our area with Stanford. We have Stanford social workers, they're excellent, very kind, respectful, and we do it with dignity because we want to make sure they're okay.
Okay, thanks. So I think Susan Doyle would like to just come up and talk about the next Sandwich Generation Series program on March 28th. Do you want to come up?
Well, I just wanted, because a lot of the questions that came up about either the hospital or somebody that's alone, the whole series is about every piece that you can put together for this puzzle. I mean, New Canaan's really unique in the area and probably the country for this local support service you have. But a lot of people don't even know that they're here. And so you got to get the word out that this is the first line of defense. I mean, this is easy. These are friends and neighbors who are willing to help and know your resources. Then as things get more complicated, there are other things. So the first, if you go through the library, the list of the programs, this is it's really the second, because the second one was postponed because of the flood. And that's what will happen next Thursday, the 28th. And we touch on all of these things. So on the 28th, it's doing things in the home. So what's called durable medical equipment, what medical equipment you can bring at home, from walkers and wheelchairs and ramps and modifying the home. A geriatric care manager who might be the person for taking care of somebody who's alone, to home care, to answer all those questions and sort of know what the tools in your belt are before you need them. Then after that, we have somebody from Waveney coming in to talk about skilled. So whether it be skilled care, if you're going into a rehab and what that means, where you need skilled care in the home. After that, in May, we have attorneys coming in to talk about all the legal issues here. And finally, we end up in June with our bit on the hospital. So very much how to navigate that. So if we hit points where you want to drill down more, first of all, you had these ladies for an hour. You have them every day. Call them, go and see them, and chat them up, and have a relationship. It's like having a banker. You go to your banker, if they don't know who you are, and you wait till a crisis, it's harder for them to help you. If they know you, they get it, and they can see it coming sometimes, and they may be able to be more proactive. The idea of this whole series is to get people talking. And you may need to talk to these people, you may need to talk to a lawyer, you may need to talk to a geriatric care manager, but learn all the roles and learn all the scenarios. If you go back to the first one, which I think was, we're sort of cursed weather-wise, because the first one was the ice storm.
Right.
So we decided at 3 o'clock of the day of the event, we're just going to do it on Zoom.
Right.
So I think we've got it recorded.
Yes.
And so that's Navigating Senior Care 101. That is a 10,000-foot view from I just want to have my daughter help me in the house to I need Medicaid and skilled nursing long-term. And done in about an hour. So that's the overview. And then each week or each month we dive down deeper. And then it's incumbent upon you to go back to the experts we bring out and dig down for yourselves. So I'd encourage you to go to the website and find out the next ones that work for you.
Yeah.
And thank you all for coming, by the way.
Yes, thank you.
Well, thank you.
So thank you.
Doyle's all the time.
I'm Susan. I let him do all the talking. If you watch the first
Will these
session,
videos
you hear
be
me
available
talking.
on the library site?
Yes, right.
Great. Well,
Videos
thank you very much.
on
Aggie,
the
Aspinwall of Lapham Community Center, Bethany Zaro of New Canaan Human Services, and Gina Blum, the Executive Director of Staying Put New Canaan. Thank you.